Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo, and as I promised you tonight, we have an interesting conversation. We are speaking with male cancer survivors. Cancer globally is the second cause of death. And remember, as our statistics by 2018, it had already claimed lives of about 9.6 million people. And something interesting about cancer, when it strikes, it does not just affect a family, but depletes resources for an entire community, talk of a nation. Let's find out, how do we stop this menace? How do we stop in terms of resource allocation, in terms of treatment, and more importantly, what do cancer survivors really go through? That is what we are discussing on Family Matters tonight. And now help me welcome our guest. Next to me is Livingstone Simiyu. Livingstone Simiyu is a blood cancer survivor. And then at the middle is a gentleman called Nathaniel Odiyo. That's right?
Yes.
Yes, and he is a leukemia survivor. And then at the far end, we have Otieno, who is a bone cancer survivor. Thank you guys for coming and for accepting to share your experiences with us.
Thank you.
All right, so do I start with you, Moses?
Yeah, no problem.
Yeah, maybe if you could just tell us when you were diagnosed with bone cancer.
Okay, thank you so much for having me. First of all, my name is Moses Otieno. I'm a bone cancer survivor. I was diagnosed back in 2014. I was still in Form 2, 16 years old. So the journey was not easy. It just started like a simple pain at the knee joint, day in, day out. So one day I told my parents, I'm not feeling okay. And they told me, we know you. Maybe you got injured while playing football. So we used to trauma it with Majimoto and then drop, massage it day in, day out, but nothing changed.
Yeah. And you'll be telling us when you went to the hospital, what exactly the doctor said.
Yeah.
Okay. Nathaniel, for you, how, when were you diagnosed with blood cancer?
Oh, it was last year. I was 23 years old. It started like a chest pain. I was feeling it like a sharp pain. So I thought that it was just a chest problem. So I used to ask my friends, they told me that it will be okay. So like assumptions always used to say, okay, I'll take painkillers, then itaisha too. So with time, my color started changing from brown to pale. I was turning yellow, and my brother used to tell me that, hey, my friend, what's wrong? I tell him I'm just okay, because I by that time I used to stay indoors. I was not doing anything. So that's how it came to happen.
Yeah, that was last year.
Yeah.
All right. How about you, Livingstone?
My name is Livingstone Simiyu. I was diagnosed in 2013. I was in campus. I was doing law in campus back then. So the problem actually started a little bit earlier.
That's blood cancer.
Yes, leukemia.
Yeah.
It's chronic myeloid leukemia.
Yeah.
It's a type of blood cancer. We have different types.
Yes.
So mine is chronic myeloid leukemia. I got diagnosed in 2013. But the problem started when I just finished high school. This is when I first had the signs. But back then we didn't know what the problem was. I went for therapies because it affected all my limbs, from my thighs to my legs. I couldn't walk properly. I had played hockey in high school, so I thought maybe these are some of the effects. But that was 2011 when the first signs started showing up. 2012 was in and out of hospital without knowing really what the cause is. Went for a few therapies, still no answer. But in 2013 is when it got so serious, until I was diagnosed and I knew the problem was. And
Yeah.
now I thought the help I got.
Yeah. All right. And for you, Moses, you said you were diagnosed, maybe you can remind us, for you it was last year, and then the first signs for you were in 2011, but officially you discovered you had leukemia in 2013.
Yes.
And for you, Moses, you said you were diagnosed with a bone cancer.
Bone cancer.
Yeah.
2014.
Which year? 2014.
Yeah.
And now it's 5 years
Yes.
down the lane. Maybe you can tell us, you said you were experiencing some pains, joint pains, and then it became serious, and then you decided to seek some medical, attention. So what did exactly, apart from the joint pains, let me take you back, what other symptoms did you express?
Okay, by then, I can say mostly it was the joint pain, because that was the only symptom.
Yeah.
So after some times, it started swelling now. So at the knee joint, the swelling started becoming massive, day in, day out. And then I was taken for an X-ray at Nema Hospital. It is in Kasarani. So they did an X-ray, but the doctor there didn't exactly tell me what was wrong. And then they referred me to Kiambu Hospital. So at Kiambu, the doctor saw the X-ray, examined it, and wrote a referral letter to KNH. And then at KNH is when I was admitted. And that was now mid, I can say March in 2014. And then I was taken for biopsy. So a biopsy test was done, and after 1.5 months, the results came out. And then I was told, you have cancer, it's bone cancer. And by then the swelling was big, like the size of my head, so massive. And then the blood pH went down. So I required some blood donations before going now for the main surgery.
Yeah. And because it took a while, like a month, were you undergoing any treatment before before maybe the outcome of the test were out?
No, I was not receiving any kind of treatment because they were not sure.
Yeah.
So the only thing I used to take was some painkillers to relieve the pain. That was diclofenac and some Panadols.
Yeah. And let's talk about receiving the news. We know cancer, when anyone mentioned cancer, most people think it's like a death sentence, honestly. Maybe how did the hospital relay first this information to you? Did they send maybe someone, your guardian, or they informed you? And how was your reaction? How did you feel about the news?
When the results were out, we went back with my dad, and then the doctor told us, like, we have bad news for you. Your son has bone cancer, and the stage now where it is, the only option is amputation. So I was shocked. I'm still 16 years old. I have a lot ahead of me, another life still. So I'm not married, and a lot of thoughts.
Yeah.
So I was worried, depression, but my dad was there, my family, they were my source of support. They talked to me. They told me, like, life is the important thing. How you appear, how you look, doesn't matter. So those were the words that encouraged me day in, day out, each and every day. And I was courageous to undergo the therapy.
Yeah, and you'll tell us about that journey. Now for you, it was last year, chest pains, and then tell us about you finding out that this consistent chest pains and you peel appearances was actually cancer. How did you find out? How were the news broken to you? And just like Moses, how did you take that?
Well, with me, I did not know that it was cancer immediately.
Yeah.
So I had to go to a local clinic. Well, I went to a clinic. I told them about the chest pain. I told them it's persistent. Well, the clinician there told me that it's ulcer. So I told the clinician, no, I don't have ulcer. I know what I'm feeling. It's not ulcer. It's here in the chest. So I later told the clinician that you can give me a referral maybe to a big hospital. So they wrote me a referral. I went to Mama Lucy. When I went to Mama Lucy, they asked me to do an X-ray and a full hemogram. After doing the full hemogram and the X-ray, the doctor asked me to take it back to his office. So when I went to his office, even the doctor maybe was a bit confused because he was looking at me like, you're so young, and he's asking, my friend, was this something? So I'm asking me, you're seeing something that I don't know how to read what you're carrying, so tell me what's it. And he's telling me, my friend, I hope it's not what I'm thinking. So then he later wrote me some medication, go and buy this drug, get injected, then after some time, you'll come back and tell me how you're doing. So from that time, it went from the chest pain now to me losing breath. I could not walk a long distance. Now I could not walk, I could not do anything, even eating. Everything was heavy for me. Yeah, it came with a severe headache. I kept on seeking treatment. I went there again. I found another doctor, asked me for another x-ray and a hemogram. I did it. When I returned the results, he told me that you have to be transfused because in the state that you're walking, you should not be walking like this. So I asked him, so what is it that you're seeing now? The doctor told me that your blood count is at 2.8. So what's that you're saying is 2.8, the level of your blood? So he told me for a normal human being, it should be from the percentage level should be between 12 to 18. That's for a male, and yours is very, very low, it's 2.8. And he told me you'll have to be admitted so that you get blood, then we monitor you, then we can discharge you, and you go back home so that we see how you'll be. From that, he told me that I think you have anemia. So it was a series of in and out of hospital, getting the blood. Sometimes you go there, the blood is not there, you have to go back home and wait. You have to go back in and out of hospital. Yeah.
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 And maybe I can engage you, Livingstone, between 2011 and 2013, when you actually found out the symptoms that you had expressed back in 2011 were actually leukemia. What was happening in your life? Did you experience some other symptoms before now finding out and getting, of course, proper treatment? And what kind of treatment options were you getting between that time and 2013 when you officially found out it was leukemia?
Okay, for my case, actually I could say it's a little bit similar to his.
Yeah.
Okay, first of all, the whole day you are just tired, fatigued, you can't do anything. Plus the pains, you can't sleep. The pains, it's like they run through your body, the whole body. So you find that you're having sleepless nights, and during the day you can't do anything. You can't walk properly, you can't do anything that is so like requires so much energy because you are tired and you don't know the reason. You have frequent headaches, you cannot explain. So the case was, I go to hospital, they take my background. Okay, where are you feeling the pain? My limbs. Okay, I do an x-ray. It's all right. They say, oh, you can't see anything. But after they do some therapies, you find that it goes away. I was getting some injections. After the injections for 2 weeks, 3 weeks to a month, I'm okay. I can do everything. Then after a while, it goes back to the same. So I was like, I didn't understand what was happening with me. Then I was back home in Western, and we only had to go to the local health center. So after I came, I joined now college. The problem continued. I joined in 2012. So I was in and out of hospital, the same problem. I've done x-rays, I've done several times. They're not seeing anything, but the problem is there. So it was in 2013, yeah, when I couldn't sleep that night. It was so severe. I had taken a lot of painkillers. I had even become an addict of painkillers. I took a lot of diclofenac. I took a lot of it. Every time, because when I feel pain, I go take the medication. Anytime I feel pain, because you cannot do anything.
Yeah.
So you find that that night, it was so severe, I couldn't sleep. I had to be rushed to Nairobi West Hospital. And upon reaching there, they did the same tests. They couldn't see anything. So after that is when the doctor said, okay, now that you're not seeing anything, let's do a full blood count. So they did, and they found out that my white blood cells were so high, over 200. And then is when I got a referral to Kenyatta National Hospital to Professor Mwanda. He's a specialist, a hematologist actually. Yeah. So then I got a referral to them. I went to Kenyatta. Then is when I did the tests. It's called a bone marrow. It's called a BMA. They did a BMA, and then I waited for the results. After that is when he informed me that actually I have blood cancer, type of blood cancer. And he, using his words, he said, this is not the bad kind, luckily, it's not the bad kind, because it's the chronic type, chronic myeloid leukemia.
Yeah. But at the same time, how did you receive the news? Because you used that nice word that it's not the bad kind.
First of all, I was so afraid because I thought they were discussing, they were discussing with my mom. And I'm like, hey, what's this big news that they want to tell me, but everybody is afraid to tell me. So I was wondering, back then cancer was not even in my mind. So I was like, hey, do I have AIDS, or what do I have that is so scary that people don't want to tell me? So, but when he said like that, then I asked my mom, what does he mean, but it's not the bad kind? She was afraid to use the cancer word, so she just said, okay, you have a condition in your blood, and the doctor says this is manageable. We can get some drugs, and you'll be okay. Yeah.
And did you try asking the doctor what could be the cause for that? Because to you, as you earlier mentioned, cancer was the least thing you expected.
No, actually I didn't. I was like in panic mode or something, because it's something that hits you and then you get confused and you're like, okay. And the bad thing is we have internet. You Google and you see, okay, I have blood cancer, leukemia. You find there, okay, 6 months. 6 months. So I'm like, okay, I have 6 months to live. But they are saying, okay, I have a chance. So I don't know. I got confused a little bit. Actually, my entire 2013, I was in denial. I didn't accept that I had it. Though I did take the medication, but I did not accept. Right.
We'll get back and then you tell us the journey. Mo says 2014, you being diagnosed with cancer, of course, after a whole month of waiting and pain, swollen knees. So how did you start the treatment journey? Did it start immediately? Maybe you can share with us, how was it like now after finding out, yes, this is it? First, how did you accept that this is what I'm going through and I need to obey 1, 2, 3? Were you in denial, as Livingstone is saying, or how did you manage to carry on with your life?
Okay, at first I was in denial. I can't lie. So I used to cry a lot. And then my family were there, my source of strength and support. They used to tell me, like, choose life. Life is the most important thing. And this is just a journey. Maybe God is preparing you for something great. So it reached a point I came to accept my condition and what I'm going through. And then after the results were out, that was maybe May, I was readmitted at KNH level 6. And then, so now I was admitted in June. I stayed for a whole month, just the hospital bed. I'm not giving any medication, like I'm not taken to theater, just lying there. So we asked the nurse, what's wrong? Why am I not being taken to theater? And they were like, your blood count is too low, 3.5. You need to be added some blood for you to go to theater. So my brothers came, they donated blood, but nothing, because that swelling was sucking all the blood. But it reached a point the doctor said, no, this swelling is sucking all the blood. No, we'll have to take you to theater, and the extra blood will just add it when you're in theater. So on 7th July, I was taken to theater, and then I was amputated. So that's where the new journey started.
Yeah.
I was confused now, having one leg, walking with crutches. This is a new life for me. It was very, very sad. I was depressed, but I thank my family and my friends because they were usually there, and my schoolmates because I was still in Form 2. They used to come every Saturday to just give me motivation, to inspire me, and yeah, I tackled the giant.
Yeah, and maybe if I can take you back, when you were diagnosed with the bone cancer, maybe what did the doctors say, the stage of the, of the cancer? At what stage was it? And then for you to be amputated, what stage was that? Because someone may be asking, was there no any other treatment option for that?
Okay, when the results were out, my dad was called in. So he was told, like, your son has cancer. So that's what I had. And then I went out, I started crying. So the rest of the information was passed to my dad. Up to date, I don't know which stage it was. Me, I was just told you need to get amputation because if we delay, it will go up to other organs. And because the bone now had fractures and the swelling was massive, nothing could be done. So the only option was amputation. Yeah.
All right. Hope you will not mind sharing with us now the journey after amputation, but it's after we speak with Nathaniel. Nathaniel, after now the doctors find out it's blood cancer. For Moses, because it was bone cancer, his leg had to be amputated. But for you, how was the treatment? What are some of the treatment options that you were given, and how was that like?
So with me, I went to Kenyatta. My family took me to Kenyatta. When I went to Kenyatta, they also did another full hemogram to know the blood count. They found it was very low. That was another after being added blood several times at Mama Lucy. So it was at around 3.5. So they took me in. They told me that there are some tests that will be done, like the one Simiyu said, the BMA. So the BMA was done and the results were out. So I am a little cheeky. The doctor, while they were doing the rounds, they could place the files somewhere on top. So before they arrived, I just went and got my file and opened it, and I saw something CML. So I went to Dr. Google very fast and I found the CML, chronic myeloid leukemia. So I was like, how comes me? Chronic myeloid leukemia, how? I play rugby, I'm strong, I'm healthy, I eat healthy. I did not want to accept it. So anyway, I said, I'm a strong guy. This thing cannot break me. So while they were doing the rounds, the doctor came and told me that I want to talk with you. Whatever I'll tell you, take it positively because you're in the right hands. We're going to give you the best. We're going to do our best. So I said, I already know that I have cancer. Well, he told me, stop going fast. Let me just break it down to you. So she started, Nathan, you know now you have chronic myeloid leukemia and I'm sorry, don't feel bad. I told the doctor, stop, and I sent her away just, and that I don't want to hear the rest, just go. I sent her away. After 1 week is when they came back to me, and now they asked me, do you want to talk? I asked them about what, you guys are expecting me to start treating me because I want to get out of this place. I came here in February, now it's March, we are approaching April. I want to get out of this place. So they asked me, they told me, we'll do for you, we'll add you some blood, then we won't do for you a chemotherapy because in the room that I was in 8A, most of the patients who were there, I could see them, they were being given the chemotherapy drugs, and I asked them, why are you not doing for me this chemotherapy so that, because it's cancer, I'm suffering from the same disease as them, why can't you just do for me the chemotherapy so that I get well and get out of here? And they said, no, you won't do the chemotherapy. You will be taking some tablets. They're called imanitib tablets, imatinib. Yeah. So after that, they told me, you'll stay here for another month, then we'll send you to Nairobi Hospital, where you'll meet Professor Ambinya. From there, Professor Ambinya will direct you on what to do and what not to do. So I've been taking the drug ever since from May. Since May, I've been taking the drug. I've seen a lot of improvements in myself. The loss of breath, it's there, but it's a little. Now I can walk a long distance. I can go back to my daily routines. I can do whatever I was doing.
Yeah.
Yeah.
Right, so you're supposed to take drugs and then after some time they will refer you?
No, the drugs, actually it's a lifetime drug.
Oh, okay. All right. And because for you, it was, for him, it's last year. For Nathan, it's last year. For you, it's 2014. Maybe you understand better than he does. Maybe you can tell us, why did you go through the same, journey as Nathan for the treatment?
Yes, yes. I did go through the same. After the bone marrow test, then that's when they know how far the cancer is and what drugs could work for you or what treatment options can work for you. So you find that after they did, the doctor explained to me and told me that you have this and it's not the bad kind, it's manageable, and there are some treatment options that we are going to give you. So they told me about the drugs, the imatinib, it's called Glyvac. So you take, and just like any other tablets you take, and then, I don't know, they work miracles or something.
Yeah.
Because after taking them for a while, the pains started becoming mild as time went by. And I just came back to normal. I went back to school. I went back to doing my exams because I was in campus. So
Yeah.
I even did not defer my exams. So the drugs were okay, but the journey itself.
Yeah.
The problem is not the drugs. The problem is the journey itself. You find yourself, you are alone. You are asking yourself questions. You are like, I was around 20 years, 21. So I find, I looked at my life. I was like, okay, I'm 21. I have this. Will I make it to 30? Or will I make it to 25? Or there is that self-doubt, you see. So as long as you're taking the drugs, yes, but the journey that you tackle needs a brave heart.
Yeah.
It really does. So mostly I was alone. I didn't want to share it with my friends, but you find that the effects that I was getting out of the drugs, they were so revealing that everybody in school started asking, but you are not like this, something is happening to you. I'm like, no, I'm okay. I'm okay. So, because back then I was in denial. I didn't want people to know I was sick. So I was, no, I'm okay. It's just some reaction, but I'll be fine. I think it's the water. That's my one and only excuse, because my skin was yellow. From a dark, I'm even still lighter a bit, but I was so dark. Then so all of a sudden I became so light until I was pale. I think it's because the blood was so small in my body.
Yeah.
So you find that after 2014, 2015, we have a support group. It's called Henzo, Kenya. It has people with the same conditions as me and Nathaniel, and also people with stomach cancer. It's called GIST. So every time you go for a clinic, you find there are several people, some walking normally, some a little bit worse than you. But the same thing is they are living. So you find some hope. And the words of encouragement we receive, you find that it keeps you going. You find people of similar characteristics, same age, probably even younger. So I found hope in that. So in 2015, I became a little bit easy. I could tell people, okay, not all people, but
the people around you.
Yeah, people around me. Because even my extended family did not really know, because I told my mom, I don't want to be treated differently.
Yeah.
I don't want to be like, that is that cancer boy, so treat him with care or something. I didn't want that, because I directly told her, if you do that, you'll kill me. I wanted to be same as anybody else.
Yeah.
Same opportunity, same work rate, same everything. I think that helped me a lot. It made me stronger, it made me cope. Because if I found that if you really get that empathy from people, it breaks you down a little bit. It makes you think, okay, I'm not okay. Something is really wrong with me, you see. So I didn't want that. I wanted to be as normal as I could.
Yeah.
Yeah.
And finally, when you decided to share it out with people, did you get what you were afraid of getting, like people empathizing with you, or you were ready now to face that?
Yes, actually I did face that,
but
I usually warned them. I told them, okay, this is my condition. I've been with it for a year now, and I've realized I'm not going anywhere. So, did you notice any changes? See, I was working, I was at school, I was doing everything. Yes, I wanted to remain the same. Because I'm telling you because you are my friend, or because I trust you, and it's an information between me and you only. So even to people I told like close friends, limited people. Only around 5 people in the whole campus knew my condition.
Yeah.
So it was, I think, a coping mechanism of some sort.
Yeah.
But it helped me, it made me who I am today now. I can talk about it openly, because after that, you find that as time goes by, you realize you are stronger, you realize you can live with your situation, and you can compete like any other person. And that is actually what even has brought me here. Not many people know, but I think I'm ready for them to know now.
Okay, and that's so brave of you. Nathan, how was the treatment cost like? Was it really expensive? I know you had your family with you, but like you said, you had to stay in the hospital for a whole month, and then you say the drugs that you were given, they are a lifetime drugs. How expensive would you say is the cancer treatment in the country?
Well, it's very expensive, especially if you don't know about NHIF, because you'll find that NHIF covers most of the drugs, will pay for you, but for me, I did not know about NHIF. My family did not know about it. So I have my brother who's called Derek. He's the one who told me, have you registered in NHIF? Are you a member? So he told me, okay, I'll pay for you the fees so that you can start with it. Just in case you're sick, you'll just use it for your treatment. Well, by the time I was getting admitted, it had not matured. So we had to part with cash so that I could get discharged out of the hospital. It was very expensive. Yeah, my friends, my family, everyone. We had to hustle, we had to sell a lot of stuff for me to settle the bill. Yeah, it's very expensive. So I would like to emphasize that we get all of us to get the NHIF, because it plays a very important role in. You pay for another person, yes. You won't get sick every day. You will assist somebody to get treated, but one day it will come to you. It will assist you. Yeah.
Okay. And Moses, the amputation journey, how did it, or process, how did it change your life? I know it changed your life, but how difficult was that?
Okay, after amputation, my life took a drastic turn. Everything changed, because this is a new thing to me. Like now getting used to walking with the crutches, the faces out there, like everyone was surprised. So it started like, I don't know, it was very, very difficult. But with the time, things improved, because I stayed in the house after being discharged from the hospital. I stayed in the house for 3 months without getting out. And one day my mom told me, like, this is you now. There's nothing you can do. Even if you stay in this house for 10 years, that leg will never grow back. Go out there, let the people get familiar with you, let them see you, and eventually they'll get over it. So I started going out day in, day out. I went. But one day, there's this child. He came and said, "Aya, ona huyu ana mguu." It got into me, and I went back in the house. So I was depressed and everything, but I started getting used to it. I used to go out, hear such comments, but this was a normal thing now. So they were like, "Mguu wako iko wapi?" And I used to tell them, nimeacha hapa kwa nyumba, wacha niende nikuje. So that thing built me, and then I got now to accept myself, and I got used to it.
Yeah, and maybe at some point, if I'm not wrong, you had to keep on explaining to people what exactly had happened.
Yes.
At what point did you now say, because of course you have to get so many questions, especially from people who didn't know what was happening in your life, and then all of a sudden they're seeing you with crutches. How was that like? You know, did you have to sit people down and explain to them, especially people in school, this is what is happening to me, and how did they receive that?
Okay, when I was still in school, they knew my condition.
Okay.
Up to when I was taken in, I was admitted. So in school they knew everything, but at my neighborhood they didn't know. So they were surprised, like, what has happened to you? So at first I used to tell them I got an accident and I lost my leg, because that word cancer was new to me. I didn't want to accept it. But eventually I started getting used to it, and now I started explaining to people. When I started now creating awareness, they were like, "You told us you had accident, and now you are creating awareness on cancer. What's wrong?"
Yeah.
So it's when I started opening up, and I started telling them, like, "Oh, my story is this, I got cancer, this was the cancer," and everything. So now everyone came to terms with that. So I can say after I went back to school 2015, I finished 2016. So when I was out there 2016, 2017 is when now everything came to reality,
Yeah.
and people started accepting who I am and what I've been through, and they gave me that support even around the neighborhood. And my friends were like, "Mose, I'm going this way, nipereke." So they were like, "You're on crutches, no, let's leave Mose." They didn't treat me that way. And doing that gave me that courage, like, these people still see me like the same old Mose. So I was happy, and I built that courage and confidence, and I trusted myself.
All right, and Nathan, just allow me to ask you this maybe personal question, if you don't mind. Of course, of course, cancer was a big word for you to get, and at some point you told me you had to just dismiss the doctor, like, go, you know. Does it mean you accepted, and then you mentioned that you are a strong and brave man, yeah?
Yeah.
But maybe you can tell us some of the things that cancer survivors in general, some of the experiences that they go through that people out here cannot understand, and then Livingstone will be helping us to also understand some of the challenges that the Cancer Survivors Association wished maybe they could change, or the country could do, or some of the awareness gap that we have.
Well, most patients, most cancer survivors, or let me just say general patients,
Yeah.
we go through a lot of stress. We become depressed. We find like, oh my God, so this is it. How will they take me? So you will be depressed. You will never want to share your story. But with time, you will go out there. When you go for your clinic, you will find someone. I met Livingstone. I met Moses. They had to share their story with me. So when I met them, they told me, "Yeah, my guy, this is what I've passed through in the past several years." So I was like, "Huh? So you've gone through a lot?" Oh, so like, yeah. So they told me, "You can share, just let it out, let it get out." So in order for you to heal, you have to let it to get out. You have to let your mind to be healed. You have to start with the mind, let your mind be strong, because it starts with the mind. Because if you concentrate on, like, now I'm sick, what will I do? Who will employ you when you're sick? Actually, who will employ you? Nobody. Because even if you go there, well, I'm suffering from this, and they will say, this guy will be at work today, tomorrow he won't be at work. They won't hire you. Like most of us, like the patients, cancer patients, most of us have lost jobs because of our condition. You find someone is sick, well, they were working initially, but currently they're not working. Why? their bosses know that this guy is sick. He won't be productive to us anymore. So they won't give you the job. They'll find someone to put in your place. You're not useful to them when you're sick, to the society. That's how some of us are being treated. That's how we see it. But, well, it will start with you, how you'll accept yourself. If you accept yourself now, the condition, I've accepted it. I want to get out of this thing. I have to share it. I have to let it go out. Yeah, you will meet people out there with the condition like yours, some with even worse than yours. They will give you hope. We always give each other hope when we go to the clinics. We encourage one another. We talk to one another. You find a friend. Well, you find someone who has survived, who was in a worse condition than yours, and now they're better. So we always encourage one another. Yeah.
Okay. And for you, Livingstone, allow me to ask you 2 questions. Let me take you back to when you were saying that the side effects of the drug that you were having, it changed your skin and then also becoming pale. Did you face some of the discrimination aspects that Nathaniel is talking about, and how did you deal with that? And finally, because I've listened to you, the 3 of you, you got your treatment locally, yeah?
Yes.
Hospitals locally.
Yes.
But at some point, because I know you interact with other cancer patient survivors, at what point now do we have to seek medication outside the country, and why is it so?
Okay, to answer your first question,
Yeah.
the discrimination is there. It depends with the people you're interacting with. For me, I just thought they were naive. They didn't know the root cause of everything, and I hadn't told them. So I did not blame them in any way. At that time, I didn't want to share my story, and I was okay with it that way.
Yeah.
They could conclude whatever they wanted, but it's all right with me because I knew what the problem was. Yeah, so it was there, yes, but that's the only way I could deal with it. I could not, like, every person who told me, okay, you look like this, you look like that, or your hair is falling or something, I could not, no, I just told them this is something else. Because I didn't want to tell them that, okay, I have cancer, and then see the shock on their face, because that's the same way I received the news, with a shock.
Yeah.
So I didn't want that. So it is there, yes, but you have just to find a way to cope with it. My advice now would be, if it's someone close to you, tell them. We find that you can sustain yourself with the support of the people close to you. It's so hard to do it alone. Yeah, I tried alone and it didn't work. I was so miserable. My 2014 is like the most miserable year I ever had, because I was alone. I was alone. I didn't want to share my problems. And I had just been diagnosed, and treatment was just at the start of it. So things were a little bit, but I managed to pull through, but now I know better. That's why even when I met Nathan, I told him, no, have someone who can help you cope with it. Yeah, because it's the best way.
Yeah.
Your second question was...
Yeah, my last question was, the 3 of you have had your treatment locally.
Yes.
You interact with different cancer survivors.
True.
At what point now do we have to have some of the survivors seek treatment outside the country?
Okay,
and
from...
why is it so big?
All right. From what I've observed, cancer is a disease that is ruthless, rather. The best way to deal with it is diagnosis. If it's diagnosed at an earlier stage, it's manageable. You find that most people who are going out, they realized or they found out they had cancer so late, when maybe it's in stage 4 or 3, advancing to 4. And when cancer is in that stage, it means it's already spread almost throughout the body. Cancer starts with one cell. It can start maybe in the breast, Then if you don't treat it, it can go to the lungs, it spreads to the liver as the stages go on. So you find out that if you find it early, then the better. You can seek treatment here, and then you can get better.
Yeah.
You find most Kenyans won't afford to go out. And there are many cancer patients, I can assure you about that. So you find that most of us use Kenyatta National Hospital. And you find the lucky ones who, like we were diagnosed a little bit early, we've managed to get treatment. And just here, and we are surviving.
Yeah.
I've been on treatment for almost 7 years. And just here, I've never gone outside the country. And I think that was to do with my diagnosis. It was found when it is not like escalated. Yeah.
Okay. And I think because time is not on our side, I'll give you like, is it possible 5 seconds? Let's say 10 seconds to speak with, there is a cancer patient watching you right now. And for you, you've put yourself together and to where you are right now. Honestly, you just look all fine. Maybe you can just give some of the things that you were talking about, depression, discrimination. Maybe someone is going through all that right now. Just a message of hope to them, Nathan.
Well, I'll just tell them that you don't have to lose hope, because it has happened, it has happened. So the only thing is you have to find someone to talk to. Just open up, let people know what you're going through. And by letting people to know what you're going through, it will be easier than when you keep it to yourself. It will be easier for you to get help than